Hope. The inborn quest for scientific knowledge has resulted in the progress of mankind. The primary aim of such scientific endeavor is to improve the human environment and quality of life. Our aim is better care of the concerned couple, knowledge about their investigations, and further education of those who serve them. We understand that each patient undergoing infertility treatment is unique, and her treatment should reflect that with a wide range of available options in the field of assisted reproduction, empowering the patient with scientific information. We hope to create awareness, impart knowledge, and offer patient-friendly treatment options. With the rapid advances in the field of assisted reproduction, guidelines and regulations are needed to avoid its misuse. Infertility affects many couples. Up to 1 in 6 couples have difficulties in conceiving, and many seek medical advice and treatment. Some patients will need only advice or reassurance. Others may need drug therapy or surgery. But some will need to be referred to a clinic which specializes in assisted conception techniques. The main factors that determine the chances for pregnancy are the age of the woman, the length of the time that she has been trying to have a family, her previous ability to conceive, and the quality of the man's sperm. In normal fertile couples, cycle fecundity averages 20% and does not exceed approximately 35% even when coitus is carefully timed. That perspective is particularly helpful when discussing and comparing the efficacy of different treatment options, typically viewed in terms of cycle fecundability. When doing so, it is important for couples to realize that the benchmark for comparison is 20% to 30%, not 100%. Women become less fertile as they get older. The effect of age upon men's fertility is less clear. If you have not been able to get pregnant after 2 years of regular unprotected sexual intercourse, either one or both of you may have a fertility problem. Tests and investigations. If you and your husband have been trying to have a baby for at least 1 year without success, there are many tests which can be done to find out the reasons why. If the cause of your infertility has not been investigated previously, the clinic will carry out the necessary tests. These tests may include an analysis of the man's semen and the conditions of the woman's uterus, her ovulation status, the cervical mucus, and the condition of the fallopian tubes. If the tests have been done during the previous treatments, you should ask whether it is necessary to repeat them. Once the cause of the infertility is identified, the doctor will offer procedures available and initiate therapy as quickly, efficiently, and inexpensively as possible. For each diagnostic etiology, there is indeed a proper approach. Even after tests, some infertility remains unexplained. But that does not mean that it cannot be treated successfully. After a thorough examination, you and your husband will undergo a series of tests that require joint investment of time, money, physical and emotional energy. Evaluation and treatment does not mean success, but at least helps you understand the reason for your infertility better. Treatment options. A very important part of the treatment to begin with is lifestyle modification, and most important is stress management. Proper diet and relief of stress through yoga and meditation is important part of healthy living. As defined by WHO, health is a state of complete physical, mental, social and spiritual well-being, and not merely the absence of disease or infirmity. The options of treatment of infertility now available are IUI, IVF, GIFT, ICSI, Blastocyst Transfer, Assisted Hatching, PGD, Adoption, DI. There are many possible causes of infertility or subfertility in both men and women. There are also many possible treatments. Drug therapy to control ovulation. Surgery to improve blocked or damaged fallopian tubes. Intrauterine insemination, IUI, using the husband's sperm. Insemination using donor sperm, DI, if the husband or partner has no sperm or very poor sperm or has the risks of passing on an inherited disease. In vitro fertilization, IVF, egg donation with IVF, embryo donation, gamete intrafallopian transfer, GIFT, intracytoplasmic sperm injection, ICSI, IVF or ICSI with PGD, pre-implantation genetic diagnosis where there is a risk of inheritable disease, surrogacy. The Federation of Obstetric and Gynecological Societies of India, FOGSI, under the leadership of Dr. Suchitra Pandit, President FOGSI, and Dr. Roza Olyai, Vice President FOGSI, is holding various CMEs and workshops this year to keep the gynecologists abreast with the cascade of developments in infertility management. The scientific program has been meticulously worked out. It is designed from basic to advances in the field of infertility, considering the interest of each and every gynecologist, trainees and students to enable them to cater to the need of the public, especially to the infertile couples in India. We hope that at the end of workshops, the delegates will go back with a take-home message from the discussions on the latest developments in the field of infertility management.
The Federation of Obstetrics and Gynecological Societies of India caters to 29,000 gynecologists across India. This is one of the biggest organizations in the world that we have. And I'm very happy that this year, under the presidentship of Dr. Suchitra Pandit, we are able to have a lot of infertility-related workshops and educative programs. Infertility is sometimes used to be called a disease, but it's not only a disease, medical issue, it's also related to ethical issues, moral values, and social problems which is attached to it. When we see that in India, most of the infertile patients, when they come to a gynecologist, they are not aware of the problem that they are facing. Sometimes they are just subfertile and we name them that they are sterile. It's not the fact that way. Maybe the issues are related to not knowing actually. That means there's lack of awareness about the knowledge of ovulation, how they can get pregnant. So the most important thing is, of course, before the couples get married, we should try to emphasize to them and tell them to encourage them to go for premarital counseling. Well, that usually doesn't happen in our society. Nevertheless, when the couple comes to a gynecologist, which is very most important view would be that the counseling should be very good and thorough. Because it is seen that 30% of the problems are related to male infertility. And males are sometimes not aware of it. It's only the blame for the women. 30% more is with the women. The issues related, for example, for their ovulation, they're not ovulating, the tubes are blocked, and sometimes it is unexplained infertility, wherein there is no reason for the infertility, and the patients, the couples are married for past 2 years and they're not yet able to conceive. Medical, situation in India has become so good now with a lot of progress in the field of infertility as well. There was time long back that the people were not aware of any in vitro fertilization. The rest, the things were unknown to them in the general population. But now we have a lot of methods, methodologies, a lot of good continued medical educations which is being organized through FOGSI that has been, making the gynecologists aware of the, to empower the gynecologists rather to know how to treat the patients better. And of course, it's the patients who get benefited in the long run. There are a lot of centers which are catering to in vitro fertilization or ICSI or higher centers with higher kind of treatments. Yet in societies we see that the gynecologists are able to cater to just, giving drugs to the patient at a very basic treatment of infertility. That is the reason why we are having these workshops, so that the gynecologist will become aware of till what situation, till what condition she is able to take care of, the cater to the patient, and where and when is a time she should refer the patient to higher center. Surrogacy, for example, is something which is not new in India. We have egg donors and so many things which is happening in the field of infertility. The basic aim of these workshops would be to encourage more younger generations of gynecologists to take up reproductive health as a topic that they could master, and they'll be able to cater to the needs of the society. I'm very thankful for the team of the gynecologists that who've been helping us with making the presentations, traveling, the faculty, and I hope as a team, as it always says, it's always a teamwork. Most important thing for the treatment, I would say, besides drug and medication, would be lifestyle management. Obesity is a disease that is happening and catching up very much in India with us. Mental health, spiritual health, doing yogas, trying to be more positive. I think these are certain things that has to be given a little more importance. And we as gynecologists who deal with infertile patients know how stressful this problem is to them. And that's one best way that we could give this positive vibes and give a little, sort of facts to the patient by showing them visuals and trying to explain to them the best scientific method which is with us. So I would like to thank all of you for your patient hearing, and I hope you enjoy the workshops.